everyone, my name is Zaria, and today I'll be presenting on vaginal candidiasis, which is a very common fungal infection caused by Candida albicans. In this presentation, we'll go over how this organism works, how it causes disease, and how it's treated, and why it is so common. Candida albicans is a eukaryotic organism, meaning that it has a nucleus and a membrane-bound organelles. It belongs to the fungi kingdom, specifically the phylum Ascomycetoa. Unlike bacteria, fungi are more complex and share similarities with human cells, which can make them harder to treat. This organism is a yeast, which means that it is a single-celled fungus. It has an oval shape that can form structures called pseudophyte, which helps it invade tissues. One important feature is that it's dimorphic, meaning it can switch from yeast to filamentous forms depending on the environment, which helps it survive and cause an infection. Candida albicans normally live in the body as part of the natural microbiota, especially in areas like the mouth, the gut, and the vagina. Under normal conditions, it doesn't cause harm. However, when the balance of microorganisms is disrupted, it can overgrow and become pathogenic. It does not require a vector to spread. The main reservoir for Candida albicans is the human body itself. It thrives in warm and moist environments such as the vaginal tract. It can also survive briefly on surfaces, but infections usually come from overgrowth of organisms that are already present in the body rather than from external sources. Vaginal candidiasis is not always considered a sexually transmitted infection. Most cases can occur when there is an imbalance in the body, such as after taking antibiotics, which kill beneficial bacteria. Hormonal changes and weakened immune systems can also trigger the overgrowth of candidiasis. Several factors increase the risk of developing this infection. These include antibiotic use, pregnancy, uncontrolled diabetes, and being immunocompromised. Wearing tight or non-breathable clothing can also create a moist environment that promotes fungal growth. The disease begins when Candida overgrows and attaches to the vaginal epithelial cells. It forms biofilms which protect it from the immune system and antifungal drugs. This leads to inflammation and irritation, which causes symptoms that patients can experience. Common symptoms include thick white discharge that is often described as cottage cheese-like, itching, irritation, and burning during urination. There may also be redness and swelling of the vaginal area. These symptoms can range from mild to severe depending on the individual. Diagnosis is usually done with a vaginal swab. Under a microscope, Candida can be seen using a potassium hydroxide or KOH preparation. In more complex cases, cultures or PCR testing may be used to confirm the diagnosis. Treatment typically involves antifungal medications. The most common oral medication is fluconazole, while topical treatments are also widely used. For patients with recurrent infections, longer treatment courses may be necessary. Prevention focuses on maintaining balance in the body. This includes avoiding unnecessary antibiotics, wearing breathable clothing, controlling blood sugar levels, and maintaining good hygiene. These steps can help reduce the risk of recurrence. Vaginal candidiasis is extremely common. About 75% of women will experience at least one infection in their lifetime. It occurs worldwide and is especially common in women of reproductive ages due to hormonal influences. In this case, a 22-year-old woman presents with itching, burning, and a thick white discharge after taking antibiotics. Based on her symptoms and history, she is diagnosed with vaginal candidiasis. She is treated with fluconazole and recovers quickly. To summarize, Candida albicans is an opportunistic fungal pathogen which normally lives in the body. When a natural balance is disrupted, it can cause infection. This condition is very common, but also highly treatable with antifungal medications. These are the sources that I use for this presentation, including the CDC, WHO, and peer-reviewed journals.